Here's a question most men are too embarrassed to ask their doctor. Is there an optimal frequency for intimacy and release after 60? Are you doing it too much? Not enough? Does it even matter for your health? Well, science actually has an answer, and it might surprise you, because the research shows that frequency does matter, but not in the way most men think. Today, I'm giving you the honest, research-backed truth about ejaculation frequency after 60, and how it affects prostate health, cardiovascular function, hormone balance, and overall well-being. But first, hit that like button and drop a comment telling me where you're watching from, because this is information every man over 60 deserves to have. Here's what most men don't know. The scientific research is actually quite clear, and it challenges many myths and assumptions we carry, like the idea that frequent activity is harmful or that abstaining has special benefits. I'm Dr. Jocelyn, and in my 5 years of practice, I've had these conversations countless times with men who want to know what's actually best for their health. Here's the truth. Regular activity and release, whether with a partner or solo, is linked to significant health benefits, especially for prostate health. The myths I hear most often are, I'm older now, so I should just accept that this part of my life is over. Wrong. Staying active in this area supports your physical health, mental health, and relationships. Frequent release depletes testosterone or vital energy. Also false. Your body is designed to produce and release regularly. It's a normal, healthy function, not something that drains you when done appropriately. Multiple large-scale studies show that men who maintain regular activity through life have better prostate health, better cardiovascular function, healthier hormones, and even a lower risk of certain diseases. So what's the optimal frequency? There isn't a single number for everyone. It depends on your health, your relationship status, and what feels right for your body. Today, I'll break it down for you. What the research actually says, the 5 most common concerns men have, and the one approach that can actually harm your health if ignored. Stick with me, you're going to want to hear this all the way through. Let's start with the science behind this. For prostate health, one of the largest studies, published in European Urology, followed nearly 32,000 men for 18 years, tracking frequency of release and prostate health outcomes. Here's what they found. Men who ejaculated 21 or more times per month had roughly 20% lower risk of prostate cancer compared to men who released only 4 to 7 times per month. Another study in JAMA found similar results. Higher frequency correlated with lower prostate cancer risk, particularly for older men. Why it works biologically. Regular release helps flush out harmful substances from the prostate, preventing stagnation. Think of it like exercising a muscle. If you don't use it, it can become weaker and less efficient. For cardiovascular health, research in the American Journal of Cardiology shows men who maintain regular intimate activity have better heart health markers and a lower risk of heart disease. Why? Because intimacy is physical activity. It increases heart rate, circulation, and vascular function. Your body treats it as a workout for your cardiovascular system. For hormone balance, contrary to the myth that release depletes testosterone, studies show regular activity helps maintain hormonal balance. Your endocrine system responds naturally to activity, keeping testosterone in a healthy range. Long-term abstinence doesn't boost testosterone, it can actually reduce hormonal signaling, which can lower levels. For mental health, men who maintain active, intimate lives report better mood, lower rates of depression and anxiety, higher life satisfaction. Biologically, release triggers endorphins, oxytocin, and dopamine, all of which support mood, bonding, and well-being. So what's the take-home message so far? Frequency matters, but more in terms of consistency and regularity than an exact number. Based on research, 21 plus times per month, approximately 5 times per week, is linked with the greatest prostate protective benefits. But here's the key. This is an average, not a prescription. Individual needs vary. Some men feel best more often, some less. If you're currently at a lower frequency, say once or twice a month, gradually increasing to 2 to 3 times per week can provide significant health benefits. And remember, this applies whether you're with a partner or solo. The benefits are the same. Addressing common concerns. 1. I don't have a partner. Does this still apply? Absolutely. The prostate doesn't care if it's solo or partnered. The flushing effect, hormone response, and cardiovascular benefits still occur. Emotionally, it's normal to feel awkward, but maintaining solo activity 2 to 4 times per week is healthy and beneficial, and countless men feel relief when they hear this. 2. I can't perform as often as the studies suggest. This is common. Research shows association, not prescription. Focus on circulation, hormone balance, heart health, and stress management. As those improve, natural frequency often increases. Even small improvements count. Moving from once a month to once a week or from once a week to twice a week is progress. 3. Frequent release depletes energy or testosterone. Is that true? No, that's a myth. Post-release fatigue is a normal neurochemical response, not depletion. Regular activity actually supports testosterone production through hormonal feedback loops. Fatigue usually stems from poor sleep, stress, or nutrition, not healthy sexual activity. 4. My partner isn't interested as often. What should I do? Mismatched drive is normal. Communicate openly, find compromise, and remember, intimacy isn't only sexual activity. Solo activity can supplement partnered activity. This is practical, normal, and healthy. 5. What if I have prostate issues? BPH, enlarged prostate, regular activity generally helps. Prostatitis, inflammation. Some men feel relief, others irritation. Listen to your body. Prostate cancer or post-treatment. Follow your doctor's guidance. Activity is usually beneficial once cleared. The key: staying active is part of maintaining health, not something to avoid. Here's the mistake many men make: complete avoidance and withdrawal due to fear, embarrassment, or the belief that I'm too old for this. Biologically, circulation decreases, tissue health declines, hormone signaling changes, prostate congestion worsens. Emotionally, withdrawal creates distance, affects mood and self-esteem, and reinforces the belief that vitality is gone. Practically, avoidance creates a self-fulfilling prophecy. Less engagement makes future engagement harder. I've seen men regret this for years. One patient said, "I wish someone had told me I didn't have to give up this part of my life. I just accepted it was over." Don't accept decline when there are safe, research-backed options. Here's what to do starting tomorrow. If currently inactive, aim for 2 to 3 times per week, partner or solo. Focus on overall health, cardiovascular, hormone, mental health. Communicate openly with your partner. Find compromises. Address function proactively. See your doctor. Optimize lifestyle. Consider interventions if needed. Let go of shame, embarrassment, or fear. This is a vital part of comprehensive wellness. Consistency matters more than hitting a magic number. Small, intentional steps compound into meaningful health improvements. This part of your health matters. It's not frivolous, it's essential. Regular activity supports prostate health, heart and vascular health, hormonal balance, mental health, relationship quality. You are not too old. You haven't aged out of vitality. Maintaining this part of your life is part of living fully, intentionally, and healthily. If this video gives you clarity, hit that like button, share it with another man who might need this, and subscribe for more practical, science-backed strategies. Remember, small, consistent actions lead to big results. Avoidance is the only real threat to your health in this area. Aging doesn't mean shutting down, it means being intentional about every part of your well-being. I'll see you in the next video. Take care of yourself, you matter.